So, hey, Dr. Ojo Cairns.
Hi, Hannah. How you doing?
I'm okay. I'm okay. You're on call right now?
I'm on call. Yes.
Tell me what we're chatting about then.
Uh, so, um, this topic sort of relates to some of the topics we've had in the past, based off of my patients that I've seen recently, and it's hit home also. That's why I wanted to bring it up today. So, the title of this discussion is "Fake It Till You Make It."
Mhm.
Fake it till you make it. Is something I feel that we as women all often attempt to do,
Mhm.
is fake it until we make it. And I know me myself, I've done that in the past, and I feel, and oftentimes within these last couple of months, I've continued to do that.
Mhm.
So, what does fake it till you make it mean? And what do I mean by that? I mean, we put everything um, on the back burner that's bothering us, everything on the back burner that's causing us stress, and try to behave as if it's not.
Mhm.
And we just try to continue with our day and our lives as if there are not things that are really pulling us down and pulling us back that need to be addressed.
Mhm.
We try to move forward without asking for help. We try to also tell ourselves that we don't need help. And also that it's okay to be stressed, that it's okay to feel overwhelmed without addressing it. So in essence, we're trying to fake it until we make it.
Mhm.
I myself am guilty of that too. Like you said, I'm here on call. And so that means that I'm working in the hospital, and I stay here at the hospital the entire time, but it doesn't mean I have no other responsibilities outside of here. I have other responsibilities. I'm a wife, I'm a mother, I'm a daughter, I'm a sister, I'm an aunt. And so outside of being a physician and caring for my patients, I care for my family too. And it can be overwhelming. It can be a lot. I'm a business owner now, and so I have employees that rely on me. And so there have been times I have felt overwhelmed and um, try to just trudge through without paying attention to that. And there are negative consequences to faking it until you make it. And so I really wanted to address those things today because it's personal. In a way, and I felt like coming on today as if I'm going to be in the chair and be able to relieve some anxiety and stress and just concerns. And that's a good thing, I think, to be able to feel that you can do that and to know that you need to do it.
Yeah, but there's a real cultural pressure that I feel viscerally that is
Hmm.
you should be able to do all this because especially when we look at particularly women, I'm speaking from that lens who we hold up on high as look at all these achievements this person
Yeah.
has done. It's very difficult to not then compare yourself to that and say, get over these little things, get over these little things. But if
Yeah.
you don't address those little things, they don't allow you to achieve whatever greatness you want.
Yes, and even when we look at those women that we admire and we respect and we see all that they've achieved, and even those that we know the hardships that they've come through to achieve the things that they have achieved, we have to also remember and put it into context. They are human beings, and so they have had hardships too. They have had um, things that maybe have pulled them back. And for those that continue to achieve, we don't know what's happening in their lives right now. I take myself as an example. On the external, things can always appear great, but you don't necessarily know what I've gone through my day to day to that maybe I didn't address that maybe needs to be addressed, or what I've gone in my day to day, like how I actually feel inside. So I think it's really necessary for us to remember those that we put on a pedestal, those that we hold to high regard. There's nothing wrong with doing that, but we also have to remember there's a human side to them, and they are not superhuman, meaning they have not been, that they don't have challenges that they actively go through. And so for us to address our own challenges doesn't make us any less uh, than who we are, or any less than them.
Hmm. And oftentimes it was recently pointed out to me, you hold up one name, but that one person maybe didn't achieve all that alone.
But
They had
yeah,
a
there,
network, a village.
exactly. Exactly. There, you know, the African proverb, it takes a village to raise children. Well, it takes a village to live, you
Mm.
know, and we all have to have support systems and networks that we rely on. There is nothing wrong with relying on those around you. I remember when I had Lily, my daughter, my mom said to me, and I felt so bad because I was in residency. And so that meant I, the majority of my day, my week was spent in the hospital working. And so that left little time for me to be able to care for Lily. And I had regret and I had guilt over that. I felt horrible as a person, as a woman, as a mom. I felt that I was letting my newborn down, felt that I was letting my husband down, my family down. And I never expressed that to anyone, that amount of guilt that I felt. But it was in some ways very paralyzing. And I was speaking to my mom one day, not about my guilt, just about totally something totally different. And she said to me, never feel bad for hiring somebody to help you take care of your child. And she phrased it just like that. Never feel bad for allowing somebody to help you take care of your child. And it was in that moment of recognition that I felt someone externally recognizing what I felt internally that I was able to release it and realize I shouldn't feel bad for asking for help.
Mhm.
I shouldn't feel bad for asking for help in raising this child because I cannot do this alone. My husband and I, we're both in residency. We could not do it alone. And
Mhm.
there's nothing wrong with relying on people to lift you up. That's what we all should be doing as people, as women. There is a quote I have in my office. It says, empowered women empower women. And that's really what we should be doing. We should be empowering others to live their best lives. And we should be expecting to be empowered to live our best lives. You're not a failure for asking for help. You're not a failure for saying that you need help.
Mhm. You're also a physician. Do you see that this or do these things have health consequences if we don't address them, if we continue to carry that anxiety and
I, you know,
all this pain?
yes, readily they do. The consequences impact your health in a negative way, increasing anxiety, increasing depression, increasing and directly increase to stress or directly related to an increase in stress. For your gynecological health, you know, this can impact your level of pelvic pain that you perceive because you have a high level of distress, because you have increased depression that can impact the way that your body perceives pain. And we've talked about that before.
Mhm.
And let's just also talk about the fact how this can impact your access to care or you accessing care that's available for women that have other gynecological issues, oftentimes because we feel the burden of faking it until we make it and doing for others and not doing for ourselves. We ignore our own health issues. And so we push out the care that we need that can be preventative, that can prevent a cancer from growing or metastasizing, or a simple problem from becoming a bigger problem. And so that itself impacts our health, impacts the level of care that we would eventually need when impacts the care that we receive.
I'm getting like actually a little emotional because I just think it's so beautiful the amount of attention EvoScient pays on preventative medicine and for care now, not out
Mm-hmm.
of fear of something worse happening, but I would have never thought of this topic to speak to you about because doesn't feel directly like pelvic floor, but in so many ways it is, as you've just outlined. What are things that people can do to find solutions to these anxieties that we have?
Well, you know, I think the important thing is to know the resources that you have available because we're all living in a virtual world more and more with virtual meetings and virtual meeting spaces. There are many virtual support groups that are available to patients. Support groups central is a wonderful resource for many different types of support groups. If you feel like you can't get out, especially in the pandemic that we're going through now, you don't want to interact face to face, you definitely can interact still virtually with others to help you, to support you through whatever you're going through. For local community events or local community resources, there are also many opportunities to have local support groups that you attend. First, even just speaking to your practitioner about what you're feeling, about being overwhelmed. It's not necessarily something that we would always say, hey, you have to see a therapist. That's not the only option. The other options are just connecting. Talk therapy has been shown to be just as good as medication therapy in treating things like depression and anxiety. And so reaching out in that way to your local provider can also help. If you are a part of a religious organization, that's a resource also. For those of us that have kids, another resource can be even your child's PTA, meeting other parents during the school year, and going out and having coffee, or just having, again, virtual meetings, which many of us parents have been doing in our parent teacher associations just to meet other parents. Most women that you meet will have, you will be able to connect with on some level, because we're all going through virtually the same thing. This has been a tough year that we've all gone through with COVID, and the impacts of COVID on our ability just to live what we call quote unquote our normal life. And so it definitely has had an impact on our ability to maintain. For me, being in the hospital during COVID has been emotional on many ends, because one, I know I'm here to help patients. I know I'm here to help women. And that's my calling. And it's something I take seriously. And so to come to the hospital and work, it was never not an option for me to work. I always wanted to. But at the same time, I have a responsibility to my family, to my children. And especially in the early days of COVID, I would find myself in my car quite often crying because of the stress of thinking that I was going to contract COVID and bring it home to my children or pass it along to my parents. The stress of knowing I was in the hospital, not necessarily being as protected as I could have been because of the shortage of PPE, personal protective equipment. And so that stress really weighed on me. And I know it weighed on a lot of my other colleagues. And often, we don't talk about it. We didn't talk about it. We just went to work because we know we were needed, and we did the extra shifts because they were there and they needed to be covered. But it's not okay for us not to be open and not talk about it. And so relying on your colleagues at work, that's another resource. Of course, we always want for our personal to stay personal. We don't want that to be used against us. And I think oftentimes that may be a reason we as women don't share, because we don't want other people to think that we can't handle or that we're not able to withstand pressure. It doesn't mean that you're not able to. It just means that you're human. And for us to give ourselves a bit more grace, I think that's necessary.
Yeah. And I think maybe if you had support systems in place and then felt scared to use those support systems, if you were lowering the amount of people that you came into contact with, you felt that all the more acutely. So it's great to think of these ways that still can exist virtually just through that support. I love that you brought this up.
The other day we were also talking about another resource, a way to alleviate stress and anxiety, Headspace. There is a mobile version of Headspace also that can be downloaded, a free version, and then it's also available on Netflix. And just a way to really put your mind in a different, I guess, setting, a meditation, to focus on the positive, or focus on ways to navigate through the negative that are constructive. I think that's also a great way to help yourself.
I love that. Just being with you, I always just feel more grounded. It's in a way nice to hear that you're human and you have anxiety and insecurity too.
Yeah, you know, you know what made me really start to think about this, Hannah?
Hmm.
I've been in a different space recently with opening EvoScient because I'm talking more publicly. First, we're doing this, you
Mhm.
know, and since we started doing this, I've been giving talks and having other webinars, and so it's a different space for me outside of the confines of a 4x4 room between just me and a patient. Now it's me and an audience, and I've started to feel more insecure about everything, quite honestly, you know. And I have taken a step back to think, why is that? What is it about me speaking in this forum versus in a patient room that is different? Well, I feel judged, you know, even though there's not someone readily telling me what you said doesn't make sense, or something to that extent. You feel the weight of possible judgment, right?
Mhm.
And so what does that do but make you feel even more anxious, not just about what you said, but what you think you want to say? And so then
Mhm.
you start to I start to second guess, you
Mhm.
know. I don't want to come off one way. I don't want to come off the other way. I want to be as authentic as I am, or as I can be, but I also don't want to offend. I don't want to misspeak. I don't want to say the wrong numbers, the wrong percentages. And so it just makes you second guess, second guess, second guess. And then the anxiety increases. And then before you know it, the whole purpose of what you tried to achieve, you've forgotten because you're in your head trying to figure out, what should I do? What should I say? And so I really had to take a breath. And I have to continue to take breaths and help myself realize the purpose of why I started these discussions, but also to realize, hey, it's okay if people judge you. It's okay if people have their own perceptions, because that's just what's going to happen. We all are living, right?
Mhm.
I will have my own perceptions of a situation, and that's fine. Um, but it really shouldn't. It should not affect you. It should not affect me, because is it hurting me physically? No. Is it hurting me mentally? Their perceptions, realistically, no. So then I have to reframe the situation, reframe it from a negative to a positive, okay, and then move forward.
Mhm. Mhm. Oftentimes, I'm pretty sure that I'm my harshest critic when I'm people do not care as much or probably are not spending as
Oh,
much time on it as I am. So why
yeah.
would I be against myself? Why would I be the first one to tell myself
Why
this?
am I the first one against myself? I think we get so much into our heads, and then you're in that cycle in your head, thinking about the same thing. And then you start to spiral down. And I
Mhm.
know I've done it. I know I do it. And I know other people that do it. I know other women that do it. I know other men that do it. But just, to be honest, we all do it. But there has to be a place where you teach yourself or learn where to stop that spiral.
Mhm.
Okay, so I don't think the spiral is bad, but you have to figure out how to stop it
Yeah.
and reframe it.
Or
And
just
then
notice that you're spiraling.
first notice that you're spiraling. You're
Yeah.
right. You're right. First noticing that you're spiraling and giving yourself the grace to say, it's okay.
Mhm.
Deep breath. What about this situation do I have control over?
Mhm.
Well, I have control over myself and what I'm presenting. What about this situation do I not have control over? Well, I have no control over how someone receives it. Okay.
Mhm.
So then let me control where I can control
Mhm.
and um, and move forward and be okay with that. It's okay. It's okay. But something that you say quite often, and I think is appropriate for this situation, what we're talking about today. Let's get better together. Let's be in this together as people. Let's be happy together. Let's be healthy together. Let's be positive together. Let's
Mhm.
get better together.
Mhm. I love that. Thank you so much for doing this. I know you're busy.
Thank, no, thank you. Thank you. Thank you for giving me the space to breathe.